There are going to be three main treatment options. For you ladies out there who have ovarian cysts but are not actively trying to fall pregnant, so your fertility is not an issue, you don't want a baby right now, you just want to know how to keep your symptoms under control. The first option is to simply do nothing and to adopt the watch and wait approach. And that's particularly for women who don't get any symptoms. Why would you do anything further if it's not causing you problems and it has been confirmed that they are simple cysts? They are functional cysts, so you simply do nothing. That may not be such a good approach for women who are actively getting symptoms from these ovarian cysts or when the ovarian cysts are large. Again, here we're just talking about functional cysts, okay? Also known as a simple cyst. So the second treatment option is to consider birth control. This treatment option is best for women who suffer from large ovarian cysts, particularly when they are recurrent. And at this stage, we're still talking about functional simple cysts, okay? Functional being fluid filled, they're not complex, they don't contain any odd material, they are just simple cysts, but they are large and reoccur and cause you significant symptoms to the point where they affect your quality of life and what we call activity of daily living. So that means that when you get a flare-up of your ovarian cyst, you can't go to work for several days, you can't look after your family for several days. For these women, putting them on birth control has been known to be effective. Now, there are different types of birth control, but the most effective one against ovarian cysts are the combined oral contraceptive pills. Combined oral contraceptive pills are ideal because they prevent ovulation, and because they prevent ovulation, they therefore prevent the resultant functional cysts that happen after ovulation has occurred. Or remember, some of the simple cysts are the follicular cysts, which form when the follicle did not release the egg. So if you are preventing ovulation altogether, you're not getting these type of cysts form altogether. The third option that there is to surgically remove the cysts through a keyhole, which is through a laparoscopy or laparotomy, and that is going to be for very large, big, complex cysts. So this option is for when the cyst is large and it doesn't resorb, it doesn't burst by itself, it persists. It causes the woman significant pain. This can also be for simple cysts, but that are large and causing symptoms, okay? So we may have to remove those surgically, particularly when they're not budging, they're not shifting, they're not getting smaller, they keep growing in size. We will have to remove them surgically. The surgical option is the only option for complex cysts, like dermoid cysts or cystadenomas, mainly because you do not want to give it a chance or risk the fact that they may change and eventually lead to ovarian cancer. So we have to remove these surgically, and when they're very big, then it's through a laparotomy, and that is when a surgical incision is made, the pelvic cavity is open, and then the cyst removed.